Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. I'd like to break down the segment today in the categories to help you explain why some of you, when you started taking hormones, may have actually felt or maybe even currently feel way worse on hormones versus feeling better. A lot of times when we recommend hormones, myself included, or medical providers, we have experienced by working with transgender populations that by a larger part, transgender individuals who do struggle with gender dysphoria, when they do start taking hormones, they tend to feel drastically better. In other words, their gender dysphoria tends to decrease, and their symptomology associated with gender dysphoria, such as depression and anxiety and other symptomology, tends to decrease as well. And that's very true still, and that's very, very common, at least from my clinical experience working with transgender people. Now, there is another segment of population that when you do start taking hormones, you don't feel worse, you don't feel better, but you feel initially neutral. So in other words, you feel the same. And then once your body gets acclimated to the hormones, or maybe once you start seeing the changes you want to see, you start feeling better. And that's normal too. And yet there is, in my clinical experience, I would say a quite small segment of adult population that when you do start taking hormones, you feel drastically worse. And by drastically, I mean that your gender dysphoria significantly increases, your symptomology related to it also significantly spikes up. So I'd like to break it down into 4 categories and help you see and understand why that might happen. So if you're watching this and you are on hormones and you actually feel yourself feeling worse on hormones versus better, you may fall into one of these categories. Keep in mind that the categories may overlap. So you may find yourself not just in 1 out of 4, you may find yourself in 2 out of 4 or all 4 categories. But it's important to be aware of this so at least you can bring these things up with your providers and with your doctors. So why is it that when you do start taking hormones and instead of feeling better, you feel so much more worse? Reason number 1 is why you feel so much more worse is medical. What I mean by medical is there could be factors such as you having adverse reaction to hormones. You're having an allergic reaction to hormones. It could be that you have other medical conditions that are contraindicative to work alongside with the hormone you're taking. It could be some other medical health related issues related to your physical health. If you're starting to feel worse on hormones, especially if you're noticing that there's the physical sense of not feeling well on hormones, I highly, highly recommend the first step is to go to your medical provider who provides hormones and to try to figure out what medically, what physically, in this sense, could be the cause for it. What is the medical, organic potential causes behind it in order to rule it out? So that's going to be a really important one. And unfortunately, for some of you, it could be such a medical cause that the doctor will say that being on hormones is just not something that you're able to do. And that's incredibly, incredibly unfortunate. But that's number 1 thing to rule out is a medical cause. The second reason why you may feel worse on hormones when you started is physical. Physical in a sense of not that you feel bad physically as you would in the medical, but physical in terms of you're not really achieving the secondary sex characteristics that you were hoping to achieve. I see this a lot happening with people who are older. The reason why I see this a lot with people who are older is because, the older you are, the longer your body has been on a natal hormone, on a hormone that you are not in alignment with, so to speak. So, for example, especially after the puberty, our hormones do a number on our bodies, right? So our hormones will create the secondary sex characteristics during puberty and after the puberty in terms of our height and our bone structure and our facial hair or lack of facial hair, chest size. All of the things are going to play into effect. And those secondary sex characteristics are not something that's going to go away. A lot of it is not going to go away unless surgical interventions are being introduced. And what I'm noticing is some people are really hoping that starting the hormone that is in alignment with their gender is suddenly going to produce physical changes that are going to help them to achieve congruency you seek. And that's for some people is very true, and some people get great changes. And for some people, the changes may be incredibly slow to almost non-existent. A lot of the reasons being is what are the secondary physical characteristics you already acquired. I see a lot of people who have achieved what we would call great changes in hormones are people who already did not look overly feminine or overly masculine based on their natal hormone. And so getting that now more authentic hormone in their body helps them achieve those changes faster. And to give you a specific example, an individual who was assigned male at birth and doesn't identify with their assigned gender and transitioning to a female end of spectrum, so to speak, decides to take feminizing hormones at an older age. Well, if this individual, for example, especially acquired a lot of what we would socially call overly masculine physical characteristics, there's only so much hormones are going to be able to do. And chances are, in my experience, it is seldom going to produce such drastic changes where the person can fully I'm trying to find a word to say it because I'm thinking about possibility, because I know possibility is important to a lot of you, but I also know that possibility is not a goal for all of you. But I also know that for those of you for whom possibility is not a goal, probably wouldn't really have an increase of gender dysphoria if you didn't achieve necessary of secondary sex characteristics. So for those for whom possibility matters a lot, if you don't achieve the expectations you were hoping from hormones, that will increase dysphoria. So this is the second reason why I see the increase in dysphoria, is where people had expectations that the physical body is going to change to such extent where they will be able to see themselves, whoever they are, envision themselves to be, and they don't achieve it. And that could be devastating, and it is devastating, and it is horrible and very painful to witness, especially devastating if you were not planning on having any surgical interventions, maybe for medical, financial, or personal reasons. You were really hoping that hormones would be just it, and you were not able to get it. It can be really devastating and really crushing. So that's the second reason why gender dysphoria will exponentially increase, is that you suddenly find yourself that you were hoping you're going to be able to leave your home, and now you unfortunately can't even leave your house because you just don't feel like you're going to be gendered in your true gender. The third reason where I see dysphoria tends to increase is for psychological reasons. So by psychological, I mean two things. One, if you have any other secondary diagnosis apart from gender dysphoria, introducing hormone can also potentially spike it up for a lot of reasons, especially if you have, for example, mood disorder. Another thing to consider is a lot of times we're hoping by taking hormones, depression will decrease. But if your depression is not a byproduct of gender dysphoria, but a standalone diagnosis, chances are the depression will need to have its own kind of treatment, especially its own pharmaceutical perhaps treatment, separate from gender dysphoria. So while for a lot of people, their depression and anxiety actually too is a byproduct of gender dysphoria, for a lot of you, those things are standalone diagnoses or can be standalone diagnoses. And so if those symptoms don't go along, it's a time to talk to your therapist and to realize that maybe these are standalone diagnoses that require their own attention. So that's number one subgroup in the psychological. Another one subgroup in the psychological is going back to what I just said about physical. When you're creating a lot of expectations of what hormones will and will not do and not achieving those expectations, it's going to be soul crushing. When you are not having realistic expectations, and because we're so inundated and bombarded by social media, and we see a lot of people claiming that they felt immediately better on hormones or they got immediate results on hormones, and you're thinking that that's going to be you, and you find out that that's not you, that can be devastating, and that will lead to feeling more depressed, feeling more anxious, feeling more hopeless and helpless. So that could be another second factor that contributes to increase of gender dysphoria when you do start hormones. And the final fourth category why gender dysphoria will increase once you start hormones versus decrease or get better is social factors. What I mean by social factors is well, twofold. One of the things that falls into social factors is how you're being read, how you are being seen socially out there by peers, by your family, by friends, by your loved ones, by coworkers. Because we're all social creatures and we all want to be seen and we all want to feel congruent with ourselves, but also congruent with the world. And that can be difficult to achieve when you feel particular way about yourself and then you go out there and the world doesn't confirm it. And while external validation is important, internal sense of well-being and internal sense of validation, I would say, is even more important. So socially, when you start hormones, and you also feel much more in control of your life and you feel like you're doing something about your life, and maybe even hormone actually is making you feel or helping you decrease dysphoria. If your social factors are such where you are in an environment where you're getting a lot of pushback, where you're getting a lot of stigma, where you're getting a lot of invalidation, where you're getting a lot of hatred, where you're getting a lot of just a lot of negativity, a lot of abuse, a lot of trauma, that in of itself, social, will trump hormones, even if the hormones are making you better. Because that's a lot of environmental factors that saturate your daily experiences and your daily living. And that combating that singularly as an individual can be incredibly difficult. So that would contribute as another part that will really lead to increase of gender dysphoria. Again, if you're starting hormones and you feel like you're finally living your life, but no matter where you turn socially, everybody you know and everybody who's close to you telling you you're making a mistake, or telling you that you're ruining your life, or telling you that they don't want anything to do with you, or telling you a whole bunch of nasty garbage, that can be very, very painful. And that in itself is going to make you feel worse, even if you feel neutral or better on hormones. So those are the four primary categories. Medical in terms of biological causes, physical causes in terms of your body, in terms of secondary sex characteristics, psychological in terms of some diagnosis being standalone diagnosis and being able to psychologically manage your expectation, and social, what is your environment like. As you can see, they can coexist, creating another layer of struggle, another layer of pain. So for example, if socially you have a social component, and then on top of that you're having maybe physical or psychological component, you can see how much more difficult it's going to be and how much more it's going to contribute to an increase of feeling worse versus feeling better once you started hormones. Comment below, let me know if when you did start taking hormones, did it make you feel worse? If you are still feeling worse, and if you're able to actually figure out for yourself what is it that unfortunately making it make you feel worse on hormones. I see that it's not super often that I see it, but it's often enough where it's worth a discussion. And I'm really, really, really sorry if you are one of the individuals watching it that is feeling or felt worse on starting hormones. I really do wish hormone was that magical pill. I just wish that gender dysphoria wasn't causing so much pain and suffering. Comment below, let me know. Would love to read your comments, and I'll see you guys next time. Bye.